All right. Well, hello and welcome to our Civic Engagement Lunch Talk hosted by the Institute for Policy and Civic Engagement. I'm so glad that you all are here to join us, and especially on this very, very wintry weather if you're in the city of Chicago or the state of Illinois. For those of you who are not, that's okay too. We're hoping you are warm and healthy and safe as well. Just want to do a quick welcome and do a couple quick housekeeping announcements. So welcome to our Civic Engagement Lunch Talk. Just want to provide you all, I'm Norma Ramos. I'm the Associate Director at IPSI, which is what we call the Institute for Policy and Civic Engagement in the abbreviated sense. Just want to welcome you here today. Our Civic Engagement Research Awards, want to kind of give you a little bit background about what those awards are. It's an opportunity for us at IPSI to support research from UIC faculty that centers on the concepts of and practices and methods of civic engagement. And so we're super excited to showcase and highlight the faculty awardees during our Civic Engagement Lunch Talk series. So welcome today to our first winter 2022 series presentation. A few online housekeeping before we get started. Just want to remind everyone to mute your mic during the presentation. You're welcome to unmute your mics during the question and answer session that we have at the end. And then you can also feel free to use the chat function. We'll be monitoring that as well and sharing that with Professor Decoteau. So just want to kind of give you a quick update about that. Okay, well, we're going to get started. So welcome to our Civic Engagement Lunch Talk on I just said the word earlier, autopsy of COVID-19 in Chicago. This is all have affected us in a big way. So the social autopsy of COVID-19 in Chicago, presented by our guest speaker and professor of sociology, Claire Decoteau. So Professor Decoteau received her PhD in sociology from the University of Michigan. Her research focuses on the social construction of health and disease, the politics of knowledge production, and people's grounded experiences with healing and healthcare system. Today's talk will report on findings from her research project that analyzed the city of Chicago's racial equity approach to COVID-19. So if you all would help me do a nice warm welcome to Professor Decoteau. Right, going to spotlight. And I'm going to remove. Alrighty. Stop sharing. Okay.
All right. Great. Can everyone hear me okay?
Yes.
Okay, great. Thank you so much for having me. I'm super excited to be here, and I hope, as Norma was saying, everyone is warm and safe and has some chance to enjoy the snow potentially later today. So thanks for having me. And thank you so much to IPSI for the support of this research, which is still ongoing, but we have some of our initial findings that I'm going to present to you today. And so I really look forward to your feedback as well. So our project is called the Social Autopsy of COVID-19 in Chicago. And I'm going to kind of launch into what the kind of puzzle of the project is, and then I'll talk a little bit about our methods. And I do want to talk a little bit about our community partners and the community organizers that really did a lot of work during COVID and also helped us to connect with residents and get their opinions of how things were going in Chicago. So I'm sure you all are aware that COVID-19 has been disproportionate in its impact. It has disproportionately affected Black and Latinx Americans in particular. So Black and Latinx Americans are 3 times as likely to have been infected with COVID and twice as likely to have died from the coronavirus over the course of the pandemic. So that's nationally. In Chicago, the population of Chicago, it's considered a majority minority city where about 1/3 of the population is white, Black, and Latinx, respectively. And cumulatively, since March 2020, 41% of deaths have been concentrated in the Black community in Chicago, and 31% of deaths have been concentrated in the Latinx community. And then in infections, 26% of infections were concentrated in the Black community, but 35% of infections have been concentrated in the Latinx community. But in addition to these sort of COVID-related outcomes, we've also seen disproportionate impact in terms of economic and housing insecurity. So Black and Latinx residents in Illinois have experienced some of the highest unemployment rates from COVID, and this is slightly out of date, but 197 households in Illinois are behind on rent, and 70% of those who have rental debt are people of color, and 80% are low income. And so I just wanted to share some of these kind of overarching statistics about the disproportionate impact that COVID has had, not only on sort of the immediate effects of the health crisis, but also some of the longer term effects on economic, housing, education, and mental health, and how those are also disproportionately laid out in terms of race, class, and legal status. So the puzzle that this project really set out to explain was federal, state, and local governments have extended a ton of resources to address health and racial disparities associated with the pandemic. And yet, according to the Chicago residents that we interviewed, policies that were designed to help the most vulnerable often did not meet existing need. And so we've sort of wanted to figure out why that is. So why, with the massive extension of resources, have those disproportionate effects been so disproportionate, and it's sort of across the 2 years. And in fact, just so you know, in case you aren't familiar, when news first surfaced in March 2020 that deaths from the coronavirus were concentrated in Black communities in Chicago, and then in April that infections were concentrated in Latinx communities, the City of Chicago and Illinois state officials responded with data-informed racial equity initiatives. Both Governor J.B. Pritzker and Mayor Lori Lightfoot have dedicated extensive resources to tracking racial statistics on infection and death, reducing barriers to testing and monitoring, expanded surveillance, healthcare, and vaccination access in Black and Latinx communities. And yet, as we see, racially marginalized Chicagoans are still experiencing disproportionate levels of infection and death, as well as health, housing, financial, and welfare insecurity. And so we were interested in tracking how this came to pass, and what was successful and what wasn't successful about local policy. So for this project, we interviewed 100 residents in the first year of the pandemic. So from August 2020 through May 2021. And we sampled in 3 neighborhoods that were very affected by COVID, especially kind of early on. Though for many of these communities, the impact has lasted, and is now, we're seeing a similar impact with Omicron. So we sampled, the 3 neighborhoods we sampled were Austin, which is right here where I'm circling, Little Village, which is here, and Albany Park, which is up here. And I'm going to tell you a little bit about each of these neighborhoods in a few minutes. So on the right-hand side of your screen, you can see the number of people we interviewed in each neighborhood. We also initially had sampled Westridge. We were trying to capture Asian Americans as well, but we had some recruitment difficulties, and therefore we actually dropped Westridge as a research site. And so we concentrated on these 3 neighborhoods, and we chose them for their racial, socioeconomic, and immigrant composition. So in case you don't know anything about these neighborhoods, these are some statistics. I know it's a lot to cover, so I'll just kind of tell you what they say. Austin is a predominantly Black neighborhood on the west side of Chicago. Little Village is a predominantly Latinx neighborhood with a high foreign-born population, so a large immigrant population. Austin and Little Village also have median incomes that are lower than the city's average. Albany Park is a more mixed race neighborhood. It is almost 50%, about 50% white, but it has a large foreign-born population. So Albany Park has large refugee groups from Somalia, it has a large Filipino population, has a large Arab population. And so Albany Park is kind of an interesting neighborhood in that it's much more racially and ethnically diverse than many neighborhoods in Chicago. And Albany Park actually had relatively high hospitalization death rates during the pandemic. Another reason why we targeted these neighborhoods was that Little Village and Austin were targeted specifically by the city for additional resources, in part because they had high rates of infections and deaths early on in the pandemic. And so they were a part of the city's racial equity rapid response team, which was the mayor's kind of racial equity framework. And so they were targeted for additional testing and contact tracing resources, some food distribution resources, vaccine distribution throughout the pandemic. And so we chose these neighborhoods because in part they were targeted by the city for additional resources to see whether those resources were getting to the people who were very, who were highly impacted by COVID. And then just so you know, because the project's sort of ongoing and I am re-interviewing, I've already interviewed about 35 of the people we interviewed the first round about their experiences in 2021 and now 2022, given the variants. And so this research is continuing. But in addition to residents, we also interviewed 65 different experts associated with policies at the city level. So we interviewed people from the Chicago Department of Public Health, epidemiologists, as well as policymakers. We interviewed people from the mayor's office. We interviewed older people from the neighborhoods that we were sampling. We also interviewed hospital administrators, clinic workers, mental health providers, as well as community organizers in these neighborhoods to see kind of how some of them were involved in the city's response, and some were sort of involved in boots on the ground, kind of organizing around getting resources to folks in impacted neighborhoods. So, so in addition to the residents, we were interviewing people who were enacting policy and kind of rolling out policy at the local level. So we have kind of 4 explanations to some degree as to why it is that resources that were dedicated towards addressing racial disparities didn't always reach the people who needed them. So why there is this kind of disconnect between the rolling out of extensive resources and their impact on the ground. And so we have 4 explanations for why there might be disconnect there. And this is a complicated story, so I'm just going to give you kind of an overview a little bit from our interviews, and then I'm happy to answer further questions. So one of the reasons is that there was, obviously, many of you who are familiar with Chicago would know this, there's been decades of disinvestment and punitive approaches to poverty management in Chicago. And so Black and Latinx Chicagoans did not have a social safety net to protect them during the pandemic in the way that many middle-class families had a social safety net that would kind of buffer them from some of the worst effects of job loss or job disruption. So Black and Latinx Chicagoans were forced, many of them were forced to continue to work in public-facing jobs, and many of them suffered worse outcomes because they had pre-existing conditions or lacked sufficient access to healthcare prior to and during COVID. So this is kind of a larger structural problem. Pre-existing structural inequality was part of the difficulty. Second, COVID-19 was treated as primarily a medical crisis, but was experienced by the most vulnerable as a much broader crisis associated with housing, employment, and healthcare. So housing and financial vulnerability should have been addressed as public health risks that lead to uneven exposure and death among Black and Latinx residents. Third, policies really prioritize the protection of the economy and the middle class over meeting the needs of the most vulnerable. And fourth, the social assistance that was made available to address financial and housing insecurity often didn't meet existing need or required extensive bureaucratic proof to access, and was sometimes then a barrier. So it was important that it was rolled out, but it has sometimes been, the way that it was rolled out was sometimes difficult for people to access. So I'm going to go through each of these and give you a couple examples. So to start off with, middle-class Americans who had liquid assets, meaning money that they could kind of mobilize right away in a bank account, or accumulated wealth. They also obviously experienced disruptions to their employment, and yet many of them had these social safety nets that would help them weather financial setbacks. But for many Black and Latinx families, that was not the case. So this is a statistic. So we have a research report that was published based on the first year of our research with the Institute for Research on Race and Public Policy, called The Deadly Disparities. And these are some slides from that report, which is actually available online from the Institute for Research on Race and Public Policy's racial justice reports. So if you go to that webpage, you can see our report there, and I pulled some slides from that report. So these are statistics from 2011, so far before the pandemic. But here we see that a third of Black and Latinx households approximately didn't really have a social safety net to rely on. And again, this predates the pandemic, but the point is that they already had there's a racial wealth gap, right? There's a gap in the amount of wealth and liquid assets that Black and Latinx families have, which does them a disservice when something like a pandemic arises. The Latinx and Black working poor were made vulnerable to infection because they were also more likely to be employed in low-paying, front-facing jobs. So this is some statistics about these are some statistics about who are the frontline workers in Chicago. And so on the left-hand side of your screen, where you see all the workers, all frontline workers, you can see that only about 30% of all frontline workers are white, which means that, you know, about 70% of all frontline workers are people of color. And then it breaks down different groups, so you can kind of see differences in which racial groups are more overly represented in different kinds of frontline jobs. So Black and Latinx workers are overly represented in frontline labor, and many of them had no choice but to keep working, either because they had family that was relying upon their income, or they were deemed to be essential workers and needed to keep working during the pandemic. And now I'd just like to tell you, so I'll give you some statistics and then I'll tell you some stories from our residents. So now I'd like to tell you a couple of stories that illustrate some of these points as well. So Armando is an undocumented Latinx man who lives in Albany Park, and he's lived in the United States for 23 years. That's Albany Park right there in the map. He and his wife were both essential workers, but they lost their jobs early in the pandemic and they began to accumulate debt. So Armando said, "I don't have legal documents. We didn't get the stimulus check from the government because immigration status is determinant. Those who undocumented Americans were not eligible to receive stimulus payments in the United States. Because people who have documents have more access to different kinds of economic and moral support in terms of health and everything." And so members of Armando's family was able to provide he and his wife with some financial support, but that slowly ebbed over the course of the pandemic because everyone was struggling to make ends meet. Armando said, "It worries me a lot getting myself further into debt." And when asked about being labeled an essential worker, but not being eligible to receive financial aid, Armando said, "Yes, that's not fair. I think the government should take into consideration this type of situation. If we pay taxes, whether we're here properly or improperly, we still pay taxes." Maria is an undocumented single mother who lives in Little Village and has lived there for 15 years. She worked for a mailing company, but she got laid off during the pandemic. And then she started working at a temp agency, but the temp agency didn't provide any benefits. And then in September of 2020, she tested positive for COVID-19, but she had to continue to work. She said, "The truth is, I didn't want to tell them. I didn't want to inform them that she'd tested positive. I didn't want to leave like that because I'm not a permanent employee and I don't have benefits. She explained that this happened throughout her community because even if you're sick, you have to work. Who's going to help with the expenses? It's an ugly thing, she called it. And then she scoffed at the label of essential, saying they kind of take advantage that you can't demand and say, okay, why do I have to expose myself and accept what you guys are giving me? I'm exposing myself, so why don't you give us help? Yeah, they're taking advantage of the fact that you can't speak up. And Maria had to leave her elementary school aged children at home to do remote learning while she worked because she didn't have any money to pay for childcare and she didn't have family who could help out at home. The unemployment benefits and the stimulus check would have greatly improved her situation. And she worried about accumulating debt to her landlord because if she was evicted, she said, I wouldn't have a clue what would happen if they told me to vacate the apartment. So working class and working poor essential workers and public facing jobs were not given paid leave time often or work protection. Some were, but it wasn't across the board. And many faced increased financial insecurity and mounting debt. So this meant that many essential workers were exposed to the coronavirus at work, or they went to work sick because they were forced to choose between financially supporting their families or keeping them safe from infection. And when speaking to city officials about the spikes in positivity rates in Latinx neighborhoods, I asked city workers, people who worked for the mayor's office, if they tried to protect workers from infection. And they admitted that there was very little that was done to protect people from getting infected at work. In addition, lower income Chicagoans of color also suffered worse outcomes because they already faced health insecurity because of pre-existing conditions and lack of sufficient healthcare access. And so many people, when they were infected with COVID, if they already had pre-existing conditions, they were more likely to have more severe versions of the virus, so more likely to be hospitalized or potentially die. So the second mechanism that we highlighted is that while COVID-19 has been largely treated as a health crisis and been fought through public health solutions, Chicago residents experienced COVID as a much broader crisis associated with financial, housing, food, and childcare insecurity. So these are some statistics from 6 months into the pandemic. It's a snapshot of statistics from 6 months after the pandemic began. And it's about area households that were behind on their rent payments just 6 months in. So again, you can see a large racial discrepancy as well as an educational inequality here. And this is another 6-month snapshot, 6 months into the pandemic, area households in Chicago who had lost income. And we see, again, a disproportionate toll on Black and Latinx Chicagoans. And it's similar with childcare disruptions. Everybody experienced childcare disruptions during the pandemic, but many people for whom that was a more serious disruption to their ability to keep their kind of financial status afloat was also disproportionate for Black and Latinx families. Residents told us again and again that while the loss of life, of course, due to COVID-19 was certainly traumatizing, there were a wide array of insecurities that they were facing. For example, when asked how the pandemic affected her neighborhood, one Black woman from Austin said, within this pandemic, we've had so many other demics. There's a violence demic, there's the losing my job demic. It's just so many demics to add on, which causes more mental health issues. Dan Fulweiler, who's the CEO of Esperanza Health Centers, which provide healthcare to, it's a federally qualified health centers that provide healthcare to people regardless of their ability to pay. He told us that the trauma that residents were facing went far beyond loss of life. So he explained, there's the trauma from disease and death, but there's also the trauma from not having money to pay your bills anymore because all of a sudden you're out of work. Even if they didn't get kicked out of housing, many were living with the stress and anxiety of not being able to pay their rent. And so you're traumatized if you had to go to work, and you were traumatized if you got fired, either way. And in another instance, one Latinx man from Austin explained that the focus on health issues often obscured broader crises that his community was facing. We have health issues, of course, mental health, drug abuse, alcohol abuse, domestic violence, crime. Just like the very mask I wear and you wear, that's what's happening. Things are getting masked. Racism is still an issue, undiscussed and hidden. And so as this man suggests, many of these broader insecurities were not as high of priority for federal, state, and local actors. And in fact, we argue that if financial and housing security had been prioritized from the very beginning of the pandemic as a preventative public health strategy to protect the most vulnerable, then marginalized communities may not have been hit as hard by higher rates of infection and death. Rental and cash assistance programs were made available to people, and everyone was extremely happy to have received them if they did receive them, but they were made available after vulnerable residents had already begun to accrue debt. And by that point, many residents had already put themselves and their families at risk by continuing to work due to financial and housing insecurity. And so if financial and housing vulnerability had been treated as a public health risk for the poor at the very start of the pandemic, then potentially this could have preemptively protected many people from housing and financial precarity. So our third explanation, is that COVID has, the response to COVID policy-wise, nationally, state, locally, has prioritized middle-class Americans and the protection of the economy over keeping the most vulnerable safe. Businesses were given extensive federal funding. Cities rushed to reopen the economy while many residents were still in crisis and struggling to cope. Labor protections and paid sick leave have not always been prioritized, and this puts poor Americans at risk of infection. And in fact, many middle-class Americans are able to work from home because poorly paid workers continue to labor in factories, shipping warehouses, meatpacking plants, agricultural sites, and along delivery routes. So for example, a health provider in Albany Park told us our patients are doing construction, housekeeping, working in grocery stores, factories, Amazon. They had employers putting them in harm's way and not letting them follow safety precautions. They didn't have the option of complaining. It was either they did the work or they got fired. And in these marginalized groups, there are often few options to speak up and advocate for yourself. So we have a lot of patients, this was a doctor, coming in who were sick and they were getting it at work. But people were trying to be as safe as they could be. And then the fourth explanation that we point to for the sort of disconnect between policy and need is that there were multiple problems with the way that social assistance was made available. Social assistance often, in the end, really only offered minimum harm reduction when more extensive resource allocation was really needed to offset existing structural inequalities. In addition, as I've already mentioned, financial and housing support were offered after residents had already experienced mounting debt and job loss and financial insecurity. And further, residents often face bureaucratic barriers in accessing financial and housing support, and sometimes payouts were extremely delayed. So people had already gone into massive amounts of debt before they were able to get some of that cost repaid. Some were already sort of at risk of having lost their housing. With housing and financial support, residents had to demonstrate that they had existing vulnerability before resources were allocated. And often this included complex and cumbersome requirements of bureaucratic proof. So barriers included language, lack of translation, technology and computer obstacles, short windows of time to produce quite a bit of proof, delayed delivery of funds if applications were accepted, and obstacles associated with childcare and work schedules. In addition, people had to get often cooperation from their landlord. This changed over time in response to some of the kind of critiques of the initial system, but oftentimes people couldn't get, their landlord wasn't amenable to providing resources to apply for rental assistance. And then a lot of people also are more likely to be in informal housing arrangements where they don't have a formal lease. And so those folks were also ineligible to even apply for housing relief. So this is from December, the number of households that were behind on rent payments versus the number of applications approved versus those that had actually been paid out. And so you see a real discrepancy between the sort of need and the meeting of that need. And as I mentioned, tenants often had to rely on their landlords to provide documentation. So for example, one Latinx resident from Albany Park explained, I don't have legal documents. It's very complicated to get any kind of support because we don't get the stimulus check. And also they wanted me to talk with the landlord so that they can send him the rental assistance. But the problem is that the homeowner didn't want to provide the information that they were asking for because the homeowner has to give their tax number. So again, sometimes landlords weren't willing to cooperate with these systems. Another Latinx man from Little Village explained that there were a lot of bureaucratic barriers that people were facing. There were different deadlines with a lot of documentation required to get housing assistance for rent. You needed to show contracts signed by the landlord. And a lot of families don't necessarily enter these contracts. They pay by the month. So getting certain documents and getting them in short periods of time before the money ran out or before the application period was over was a barrier. So just to wrap up here, instead of kind of designing policies that were really kept the most vulnerable at the kind of head of, at the kind of forefront of policy making, which could have included things like canceling particular months of rent, offering paid sick leave and work protections, providing cash assistance and free medical treatment across hospital systems. Instead, the most vulnerable working poor in Chicago and elsewhere around the United States ended up exposing themselves to dangerous infectious situations at work, in public spaces, and at home, often so that middle-class Americans could remain safe. And these kinds of issues, of course, continue today with Omicron. It's not over by any means. And so we can talk more about that if you'd like to in the Q&A. So thank you for your time today, and thanks for allowing me to present a little piece of my work. And again, here's the funding that we've gotten and some of the other folks who were involved in doing the interviews and gathering research.
Thank you so much, Claire. All right. Okay, I'm going to stop recording. We're going to move into our dialogue session.